Hello, and welcome to another episode of Thoroughly Thriving, where we're putting human back in human capital solutions. On today's episode, we're going to hear from an industry leader, where they're sharing their thoughts, feedback, and perspective on what's happening in today's world of work. Well, let's stay tuned and perk our ears up for another exciting episode. Welcome to another episode of Thoroughly Thriving. And am I thoroughly excited for today's guest, Sean? We have a phenomenal guest who I met earlier this year. My wife, Gina, who is in the industry, a seasoned leader in clinical operations, was speaking at a BioLife conference here in San Diego. And before she spoke that day, there was a panel that had been set up before her speaking engagement. And I heard Travis Stiles from Novaron speak, and I said to myself, I've got to meet this guy for a number of different reasons. How passionate he was and how direct and transparent he was. And that combination, it makes for a phenomenal guest on Thoroughly Thriving. So I did want to introduce our guest today, and we're going to hear a lot from him. Couldn't be more excited to hear about what he has to share and impart with all of our listeners. So Travis Stiles is our guest today. He is the CEO and co-founder of Novaron Bioscience. And for those that aren't familiar with Novaron, they are a company that's pioneering in the field of CNS regenerative medicine with a profound commitment to developing breakthrough therapies. And Travis has been on the forefront of scientific innovation, really focused on reversing the damage to the central nervous system. And one of the most challenging and complex areas in medical research is the CNS, that central nervous system. So I couldn't be more excited to hear about what he's going to share with us today. But I'll tell you, under his leadership, Novaron has made significant strides in advancing treatments for conditions that were once to be not being able to really be fixed or repaired. So I couldn't be more excited. So without further ado, welcome to the show, Travis Stiles.
Thanks for having me. Excited to be here.
Yeah, we're really excited to have you. And I even found out during some of our prep work that Travis and I actually went to high school about probably 15 minutes from each other, and probably were driving across the road back and forth trying to miss each other. So Travis, so glad to have you join us and really excited to hear more about your story today.
Me as well. Excited to get into it.
Travis, as we were preparing to have you on, there's a lot of questions that Sean and I have for you. And as I mentioned, our audience really spans a spectrum from emerging biotechs to startups to publicly traded as well. But your journey, your career, I know has a lot of identification with any listener that I have. But to start off with, Travis, can you share with us what inspired you to specialize in CNS regenerative research?
Yeah. So, to be honest with you, I didn't start out seeking this field. I actually wanted to be an orthopedic surgeon. I was actually an exercise physiology major in undergrad. I got my master's in human physiology, exercise physiology, and my transition to research really, my transition away from medicine and into research really came kind of towards the end of my undergrad career, when one of my fraternity brothers actually was diagnosed at the age of 19 with ALS. And as many people are probably aware, ALS is a devastating condition. There's no treatment. It's really devastating. But the younger you are when you're diagnosed, the worse the prognosis and the more rapid the disease tends to progress. So Callan at the time was very young and very active. He was actually like a judo champion. And so from the time he was diagnosed till the time he passed was less than a year. And I just remember at the time feeling that I wasn't naive to the sense that there were diseases out there that there was no cure for, but it was a real struggle to see somebody so young and vibrant where there was literally nothing. I mean, like even when he was hospitalized, like it was basically just life support, right? So, um, and I remember feeling like this sense of helplessness that you could sense also in the medical staff, in the doctors. Like, these are people, especially neurologists, who tend to have a bit of a God complex for good reason. It's not even a criticism. What the job they do is, you got to walk into the room every day thinking you can save lives. But that mentality, to walk into a room where you're completely powerless, I think it's even more of a contrast to them, and I think it's even harder for them. And I remember kind of being mad at the attitude of this, like, no eye contact, shuffling their feet, and being like, hey, like, engage, like, be a human. And it was a turning point for me, because I realized I actually don't know if I want to do med school where, when I'm out of med school, I have a certain set of tools, and if there's a problem that goes beyond my skills, I don't have a ton of options. And that's kind of when I was like, okay, I think I want to go into research. I also had an advisor at the time, Julianne Abendroth Smith, who, as this was all happening, she basically pulled me into her office one day and was like, well, so what are you doing after this? And I hadn't really made a plan. And she basically browbeat me into grad school as well then. So she has a major role to play in where I am now in my life. But I was still very much interested in, like, the human physiology side of things. And so I decided I wanted to go into research on muscle atrophy and hypertrophy, because one of the things with ALS, like, if you can preserve skeletal muscle mass, it is a really strong indicator of, like, delaying the progression of the disease. Not to mention that, think of all the people you could help in cancer and HIV, and not to mention just, like, injury recoveries, if you could prevent atrophy. So I actually that was my whole idea when I was looking for PhD programs. I actually looked at UCSD, which is where I did my PhD in biomedical science, and I was actually interested in there because there was a researcher there named Mike Hogan, who at the time was doing some of the coolest, most cutting edge stuff in terms of muscle physiology I'd ever seen. Just like real time live cell imaging of individual muscle cells, sarcomeres, being able to see calcium influx, and just, it was really cool stuff. And I saw him speak at a conference, and I was like, that's what I want to do. But the cool thing about UCSD is they don't let you pick your lab when you get there. Like, you have a year, and you have to do rotations, and you have to do your round. So, like, every different research group does like a 6-week seminar series where you get exposed to everybody's research. And I had grown up with an uncle who had been paralyzed in a horse riding accident. So I had always been peripherally aware of the irreversible consequences of spinal cord injury, and, like, how devastating it can be. Um, but I wasn't really a neuro guy. But I remember, like, the second round of seminar series at UCSD. We were in the neuro round, and there was these two sequential talks, and, like, I'll never forget them because they've had such a big impact in my life. But there was a professor, Ben Hai Zhang, who was a newer professor at the time, and he was a spinal cord injury expert, and he was talking about how, spinal cord nerves actually have a tremendous ability to regenerate. They just don't, because there's things in the environment that tell them not to. More importantly, they had done this experiment where they had taken nerves from the brain and put them into grafts from the sciatic nerve. So it's a peripheral nerve graft, right? And shown that those nerves grow just fine. But if you take nerve grafts from like a leg or wherever else and put them into, like, the brain, they'll grow right up to the brain interface and then stop. Proving that it's like it's not the nerves, it's the environment that's telling them not to grow. And I remember just being like, so we like, okay, so there's these molecules that are telling the nerves not to grow. Like, okay, cool. Let's go block those molecules. Let's figure it out. Right. And of course that's what the field was doing. And I just thought that was really cool. But again, it wasn't my space. And then there was a talk shortly after that by Katerina Kosoglu, who remains to this day to be one of my idols in terms of in science. She's now at UCSF. And she's actually done some amazing work. She had just started her own biotech, 3 Biosciences, that's thriving. But she's just an amazing scientist, and both ended up being on my thesis committee. But she was talking about similar in multiple sclerosis, how in multiple sclerosis, you have these attacks on your brain tissue, right? And it basically strips the coating off of your nerves, the myelin coating. And normally your brain is really good at repairing that. But in the case of MS, there was these molecules that would also impair new cells from being able to repair this mess. But the thing that really struck me was that in both instances, so spinal cord injury and MS, the factors that were leading to this inhibition of repair there was the Venn diagram overlapped a tremendous amount. And I was like, what? So you're telling me if you fix one of these problems, you might fix both? That's cool. And it kind of just went about my day, right? But it stuck in my head. I was like, that is so cool. And like fast forward like 4 months later, and I'm in an oncology seminar. And the chair of pathology at the time, Steve Gonius, was presenting on his research in a receptor that has now become like one of the biggest focuses of my life, which is the LRP1 receptor. But he was looking at it in the context of cancer and inflammation, or in how those things work together. But he had happened to be working in a glioblastoma, phenotype. So it was it was cancer, but it was like a CNS cancer. So they didn't really do neuroscience, but it just was ancillary related. And he like goes through this whole talk, and he has this one slide at the very end that it was almost like a throwaway slide. And he goes, and also we discovered that this receptor is a novel receptor for myelin debris. And myelin debris is one of the major sources for these molecules that impair both remyelination and nerve regrowth. And so I really didn't have a ton of interest in oncology because everyone's does cancer research. I wanted to do something, different. I was interested in physiology and things like that. But that caught my ear, and I immediately was like, raised my hand. I was like, well, myelin debris is like a really big factor in terms of suppressed regenerative ability of brain. Like, have you looked at it in that context? Like, you work on this receptor. Have you thought of this? He's like, nope. And we won't. We don't do neuroscience, but thanks for your question. Moving on. And I just remember being like, what? So after the lecture, I walked up to him and I asked him if I could rotate in his lab because I needed a rotation for the next quarter, and just play with this and just see if it was actually, because like, what a cool, at the time I was like, there's no way this is a thing. Like, me as the peanut gallery first year grad student, of course I don't know what I'm talking about, but what a cool rotation project. What a cool thing to try for 3 months. And he said no, he didn't want anything to do with it. But so I ended up going back to the previous two professors that had talked about this, mentioned what had happened, asked, I was like, do you think this could be a thing? And both of them were like, oh, absolutely, this is cool. And so they ended up together marching me over to his office and basically saying, you got to take this kid. We're interested in this project. We'll help mentor him as well. And then I was the luckiest grad student in the world. So he agreed. I spent the first half, so about the first month and a half, learning how to grow neurons, how to culture them on plates, and how to purify myelin, because that was the source of these inhibitory molecules. But they had already worked through all the ways to manipulate this receptor. They ways to knock down the gene expression, ways to block its function. So once I got these systems set up, all I did is use the tools that they already had available to basically either genetically silence the receptor or to block it. And just my very first experiments, you were seeing nerves that would normally not grow like crazy. And so I was the luckiest kid in the world. Here I was, like, everybody goes to grad school hoping they can find something that means something like this. And here I am sitting on my first outcome of this rotation, where it literally has become the centerpiece of like my life's work. Because ever since then, I've been working on, characterizing how this receptor works in that context. And then as I learned more about it and realized the implications of being able to manipulate not only this receptor, but other members in that receptor family, and how important that could be for disease, I just got so lucky that I was able to kind of step in and see something.
Phenomenal, Travis. Yeah. And I think that really dovetails well into, can you tell us more about the journey to ultimately found Novaron? What did that look like? And it sounds like, obviously that was a phenomenal catalyst.
Yeah, I mean, and honestly, it's an extension of the same story because really, once that first initial finding hit, and then obviously nobody trusted the new rotation students. So a couple of the project scientists, so like really senior scientists, stepped in to replicate my work, and both of them replicated it. And then all of a sudden, we had this kind of meeting, and everybody's like, "I think we have to work on this now. like I think we need to make this a thing in the lab." And so my mentor, so my boss Steve he was the chair of pathology, so he was my technically my mentor, but he was a very busy guy. So Alban Gaultier, a project scientist in the lab, was really my day to day mentor, and probably easily the biggest influence in my life in terms of the scientist I became. And just a tremendous guy, one of the best scientists I've ever known. But we ended up working, really carving out a niche for ourselves, and as we got traction, we built a little team around it. But so a lot of it was, you basically make a bunch of different nerves grow. Does it work in this nerve type? Does it work in this? Like in all these ways. And then, the rest of my dissertation work was really around characterizing the mechanism and things like that, really fleshing out, the pathway, and like getting the whole story together. But it really, as the project progressed, at one point the university tech transfer office came to me, or came to my boss and said, "Hey, we've heard about this work. Can you tell us more about it?" And so they pulled me in, and we gave a little update to them, and they're like, "We want to file some IP on this. We want to file some patents on it." And I was like, "Well, that's cool." I had no idea what that meant, but I was like, "Oh, I'm going to get a patent. Yay. Like, that's fun." And so, just to give you an idea of kind of the traction we were getting, and then like towards in my fifth year, Alban got his own faculty job at UVA, and then a couple of the other people that were working on the project, went to med school or whatever. And so Steve came to me and he said, "Hey, like, this has been great. This is a great project. Like, we've done some really cool stuff. But when you're gone, like, I basically have nobody left here who even knows how to do what you do. So I want you to know that you can take this with you," which is a big deal. Like, typically labs don't give up lines of research, but Steve's a very successful, scientist, and he had plenty of good paths going on, and he just kind of realized, I'm probably not going to be able to keep this going. There was literally like three of us that all left within a 6-month period, and he's like, "I just don't think I can keep this going." And it was very nice of him to give me his blessing to keep doing the work. But I'm going to tell you a little secret. When you're applying for jobs, so as I was applying for postdocs, what your person that's looking to hire you doesn't want to hear is what you're going to tell them you're going to do. So like I was looking I was interviewing for postdoc positions, and I was like, "I want to work on this." And they're like, "No, I'm hiring you to do the things I'm doing." And so I realized very quickly that, like, even though I'd gotten this blessing from my boss that I could work on this stuff, there really wasn't a path to me finding a way to keep it going on my own. I was still early in my career, and there wasn't really a way for me to get institutional support because I wasn't advanced enough to be an investigator on my own yet. And everybody has their own thing they're working on. So really what happened was is a close friend of mine in grad school, Taylor Bright, his interest in grad school from the beginning was always, how do we get good and exciting technology out of universities? Because as you guys are probably aware, and I'm sure many of your audience would be aware, academia is a major driver of innovation across the globe. But academic transitioning from academia to industry is actually a pretty big bottleneck because academic institutions aren't really made for tech transfer, handling IP. And so, getting good technology out of universities is just kind of a general problem that as a society, we kind of know is a thing, right? So when he found out about my project, he came to me and he's like, "I want to start a company." And I was like, "You're insane. There's absolutely no chance I'm doing that. I can't even get a postdoc to do this. Why would anybody make me a CEO of something to do it?" And him, and then my other co-founder, Sean, who we met at a March Madness kind of just social event, who they met. They were both friends of mine, but when they met, and so we're hanging around watching basketball, and they start talking about my work. And so Taylor convinces Sean, who had experience in startups but in the tech side of things, and was a finance expert. He decided that he wanted, so he got Sean on board with the idea, and now I had two of my friends that were constantly harassing me, and so for about it took them about 6 months, but they finally convinced me, okay, all right, let's give it a shot. let's form an entity. And we decided what we were going to do because we weren't going to be able to raise capital around this. So we formed an entity and we started writing grants. And that was the one thing about where we were is that allowed us to do that. Like the U.S., the NIH has a program specifically set aside for this type of thing, for getting technology out of the universities, is this STTR SBIR program, the Small Business Innovation Research program. And it's actually a small business administration initiative every grant funded agency does it, DoD, NSF. But because even though I wasn't really eligible for academic awards, as a founder of a company, I could apply for these SBIRs. And so we started writing SBIRs. And so the very first grant that Novaron ever got, I literally hadn't even finished defending my thesis yet. And so we get notice of award, and that was it. After that, then, well, crap, now we have to have a company because now we have money to do it. So it really, I think that the interesting thing about Novaron and its origin story is that I did not want to do it. I thought it was crazy. It was really about just the necessity of, I also couldn't stomach the idea of letting the project die. You think about how lucky I was to be able to stumble across this project and to literally be sitting on the precipice of potentially being able to make people walk again, right? And then to just have, because of the logistics of the academic system, have it die on the vine. That wasn't something that I could really stomach. So this gave me a path, and so it was really out of necessity. That was it.
That's great.
Yeah, no, wow. That's awesome. All right, Travis, we've got a few minutes left here on the podcast. I'm going to ask you a two-in-one question just to kind of land this. So now it's been a few years since you've transitioned from getting that first grant and launching the company. You've obviously seen some really interesting times environmentally outside of your company, from investment to COVID to post-COVID to everything that has gone up and gone down and starting to come back up again over the previous few years. And the one word that I can think of that has to be a core value of yours in order to continue forward through a lot of this has been resilience. So my two-part question is, tell me a little bit about, the resilience you've had to learn in jumping in and starting this, having the IP, having a lot of the research, but having to learn a lot of things on the fly, learn a lot of lessons, get the bumps and bruises as you go. And then secondarily, tell me a little bit about your vision, what you see is possible in your space in the next 5 to 10 years. What do you think's really within reach for us, from a scientific perspective?
Yeah. So starting with the first part, I'll say, Novaron's been around for a long time now. And I would say the gift and the curse of that is, a lot of times people look at us and they're like, well, you've been around for 10 years. Like, why haven't you cured everything yet? Right. But I think it's important to note, like, for the first 6 years, we were all grant funded, and it comes in waves. And so you'll sometimes be really well funded and sometimes not. And so what that allowed us to do is to advance, but very slowly, but to advance the proof of concept and build up our kind of data set. But in a way that also gave me the time to grow as a CEO. And what I tell people, like scientific people that are interested as scientific founders and starting companies, they'll often have imposter syndrome because, let's be honest, academia, life sciences, it beats you into submission that you need to be deferential. And you can't be deferential in biotech. You have to be confident and you have to be able to sell your ideas. But so it gave me the opportunity to kind of like get an experiential MBA in a way, right? And like get exposed to the jargon and the language people used. And so, I think that a lot of what I think the resilience is one, you really have to believe in what you're going to do, because as a startup founder, unless you come from wealth, unless you have a nest egg, or unless you know a rich uncle that's going to basically give you 3 years of runway, it is going to suck. 100%. You're going to have times where it's hard. If you don't really believe that what you're doing is worth doing, if you're in it just for the profit potential, you'll quit because you should. It's not worth doing unless you're doing it for a bigger reason. Entrepreneurship is a rough path, but it is also very fulfilling. I think the blessing of the last 10 years of my life is, like, even when times were tough, I knew every day why I was getting out of bed. And that's a blessing. So I think recognizing what imposter syndrome is and then not letting it be limiting. Taking advantage of every opportunity to immerse yourself and to learn, find good people to mentor and support and network with. And honestly, if there's anything that's a strength of San Diego, it's that people's willingness to embrace one another and to offer free advice and just be supportive. I think is a real unique strength of San Diego over other biotech hubs. But I think and then you've got to leverage what you will inevitably have, which is probably at some point going to be youth and energy and passion, but you have to be able to weaponize that in a disciplined enough way that you learn what has to be done from an execution standpoint to advance your ideas. Because as an academic in the academic realm, it's a free flowing, just the pursuit of hypothesis driven research. You don't have a goal. There is no destination in mind by definition, and that's a good thing in terms of discovery stuff. But when it comes to biotech, you have to deliver. You have to deliver a product. So I think knowing you can do it, and then investing in yourself, and making sure that you surround yourself with smart people, find people that are like-minded, and really just like inevitably you're going to come across people that the path was laid out for them. They either had the capital in hand, or they were well networked with people that could write big checks. And it's very easy. They're not the majority of the people that do it, but they're the most visible, and it can be really discouraging because most of the time you're not going to ever be that person. So you can't let those examples. It's really easy to look at those people and be like, I'm never going to have that advantage. I'm not going to be able to make this work without it. Because that is a tremendous advantage, and the likelihood of success is much stronger. But a lot of times I think the superpower that people don't appreciate is the struggle actually can make you better when you come out the other end. Having to scrape and scrap and do things to ball on a budget and figure it out on your own. I think at the end, if there's anything that I came out of that, I was a better multidisciplinary kind of generalist in terms of what it would take to develop a product, because I had to do it with just me, and at any given time, maybe 2 or 3 people working alongside me, and I couldn't rely on consultants or hire the expert. I had to figure it out. So I think in terms of the story of resilience, I think that's probably the message I would give people is like, if you can come out of it on the other side, you're going to be better at your job. And from there, I think what's really important is when you do come out on the other side better at your job, start building the reputation so that you can help lift other people up on the back end, the way that people have lifted me up. Because I think that is really, when it comes to the societal benefit of innovation, making sure that we're not restricting ourselves to the easily resourced ideas, but the really good ideas that have to scrape and claw to get seen. I think as a society, investing in that and making sure that we're lifting innovative founders and inventors up, I think is a really important thing as a society.
That's great.
So we're probably out of time. I was just going to say, I was going to touch a little bit on what you asked about with what's coming next. So right now, Novaron has 2 main focuses. We're really experts in this family of proteins that are really important in a variety of diseases that have been thought historically to be bad drug targets, similar to GPCRs decades ago. And it just so happens that a big concentration of those problems are CNS neurological conditions. So spinal cord injury is my baby. It's what I've been a champion for since I started, that first experiment in like 2008. But we've got a lot of traction right now on a dementia program as well, because our receptor we work on, LRP1, in 2020 and 2021, a whole bunch of papers came out saying it was a master regulator of tau spread, which is a really unique and cool mechanism of action for how dementias like Alzheimer's disease actually progress, as they actually spread the protein from neuron to neuron. So in terms of spinal cord injury, like, let's be honest, Alzheimer's has been an intractable problem for many years, but we've had a couple drugs that have been approved recently, mildly beneficial with some side effects, but we at least have something. Spinal cord has nothing. There's nothing that works. And there's a couple problems that spinal cord faces. It's a small market. It's viewed as a really intractable, multi-pronged problem, because you've got the usually a trauma from an accident or some other sort of mechanical damage, as well as this difficult to access part of the body for drug delivery or whatnot. So a lot of times you might need like a drug device combination or multiple different drugs. And so nothing's really worked. And it's a very under-resourced field. There is trillions of dollars in the Alzheimer's space. There's at one point, I think I was looking at this in like 2016, there was something like 130 plus clinical trials going on in Alzheimer's that were drug trials. And like each one of those you can think is probably, if you're into phase 2 or 3, is hundreds of millions of dollars, right? Whereas for spinal cord, at any given time, you might have 2 or 3, and that just shows you the discrepancy in resourcing, right? So, I would say that spinal cord companies like ours, like I think the story of the resilience and having to fight to get by actually serves a spinal cord company very well. It also kept us alive long enough for this thing to fall in our lap, where all of a sudden the thing we've been working on that nobody cared about was important for Alzheimer's. And now we can leverage that FOMO and that interest in that space to lift all ships, right? Which is, I think, strategically a really important thing that we've tried to be open to not limit opportunities. But I will say that in the spinal cord injury space, I think more and more the field has started to recognize some of the limitations when letting individual companies fly on their own to try to get a drug across the finish line. It's just such a slog. I think more and more you're starting to see, stakeholders come together to create the infrastructure and the resources and the initiatives and the non-dilutive funding opportunities to be able to really make that path more tenable, less prohibitively, to throw less roadblocks in your way. And I really think that, even with all the new modalities of stuff that's coming online now, with, you've got antibodies and small molecules and ASOs and things like that. In addition to, now we're having these really good successes with epidural stimulation, with device type stimulation and whatnot. I really think that spinal cord injury, you're looking at over the next 10 to 15 years, we're going to see some really big inflections. And I think the key to that is companies like ours are increasingly looking to partner with other hungry companies to try to combine resources in a way to do the best possible drug development as opposed to the minimum viable path. I think one of the things that is really, you have to recognize that you as a small company, you're going to be resource constrained, but because of that, you have to do more in terms of your development, because you don't have the luxury of having 12 programs and letting 4 of them die. You usually have 1, maybe 2. So whereas the pharma motto is to fail early, right? Like that's, you hear that all the time, fail early, fail early. The VC motto is fail early. You have to fight that, because the worst thing is you can do as an entrepreneur is risk a false negative, is risk your drug working, but you not seeing it because you didn't develop it enough. And I think that we've really started as a field to really recognize that, and things are they're showing a lot more promise, and people are working in a lot more disciplinary ways, and a lot more stakeholders are getting involved early to prop up a more robust network to get these things across the finish line. And then in the Alzheimer's space, aducanumab and Leqembi are the 2 antibodies that have been recently approved. I think that those are going to serve as a foundation where we've just started to scratch the surface of being able to affect this disease. And now I think you're going to start layering things on top of that. That is going to make it even a much bigger difference, because you've now kind of crossed that barrier. It's possible that seeing efficacy versus how much you have to do before you hit efficacy is huge, much huger than we think. So the fact that somebody's traversed both of those things to even get here now means if your drug does anything, the odds of being able to see it on top of that are going to be even better. So I think the next decade in dementia research, not just Alzheimer's, but FTD, which is what Bruce Willis has been diagnosed with, supranuclear palsy, even CTE, the boxer, football player disease. I think you're going to start seeing a lot of amazing advancements in those spaces because of the fact that we've now crossed a threshold where we have something that does anything. So,
wow, Travis, thank you so much. It is clear, it is evident, it is certainly apparent that you are passionate about overcoming barriers to innovation, and how you've been so resilient over these several years. So thank you for everything that you're doing, that Novarone is doing. We're excited to watch your journey and support you in any way that we can. Well, friends, thank you so much for joining another episode of Thoroughly Thriving. We've been excited about this episode. We're excited about what's to come. So stay tuned to upcoming episodes. And look, we can only win as one if we work as one. So have a great day. We'll see you soon.
Thank you for joining us today for another great episode of Thoroughly Thriving. If you enjoyed today's episode, please feel free to share it with those in your world. If you'd like to learn more about the Thorough Group, please go to thoroughgroup.com. And remember that we will all remain thoroughly thriving if we continue to work as one and win as one.